Thank you, Tom. And thank you, Susan and the American Public Health Association for their terrific leadership in furthering not just National Public Health Week, which we're here to celebrate, but public health matters every day. And so I want to talk a little bit about San Diego. And like many of our communities across the country, we're learning together and figuring out kind of this space, what we call our wellness ecosystem. And we know clearly we're only going to achieve that type of ecosystem across sectors. Susan touched on this. At the time, it was the Institute of Medicine. They did a study. And the title was Shorter Lives, Poorer Health. It says it right there. And we compared last to 16 other industrialized nations. And there's lots of reasons, but one of the, and the focus today about cross-sector collaboration, is that in these other nations, they figured out a way of rebalancing safety, human services, housing, public health in a way that we are quest to do here in the United States. And so remember that report, Shorter Lives, Poorer Health, because I'm going to reference that in a moment. So what brings us all together? These three numbers we share all in common. It affects all of us in every community in this country. In fact, even now, north of us in Canada and south of us in Mexico. And it's 3, 4, 50. And it's these three behaviors, right? Lack of exercise, poor diet, and smoking. And those two pictures of lack of exercise and poor diet are actual pictures from San Diego. So we're not living well in the entire of the region. And we know that these three behaviors, though, impact 4 chronic diseases. And in San Diego, for us, cancer is a leading cause of death. But of these 4 chronic diseases, it's cancer followed by heart disease and stroke, followed by diabetes and respiratory illnesses like asthma and COPD. As you know, in our country, cardiovascular, heart disease, and stroke is the leading cause. And then we know that these 4 diseases lead to over 50% of all deaths in all communities. So what we're talking about here is preventing the preventable. Because in many of these chronic conditions, we know it is about behavior. It is how we live, work, play, and pray in our communities that have a greater influence than our genetic code, right? You've heard about the zip code mattering more than, in fact, your genetic code. So we know that we can't do this alone when we think about all these other components of how we live, work, play, and pray. And when you then look at the cost burden, we measured this in San Diego, those 4 chronic diseases. It's about $4.5 billion of direct medical care expenditures. That does not factor in a loss of productivity. In our country, $1.2 trillion on direct medical care expenditures. I can tell you this, you're going to hear from the sheriff soon. I know she can use those dollars in many other ways, protecting the public's health and safety. And so if we got better health for it, it's one thing, but we're not. So there's an economic burden, and what we saw is clearly our path forward in San Diego was what we call, what Tom referenced, this Live Well San Diego. We went and said this is about really a cultural movement. And it started in 2010 when we stood it up and approved by our County Board of Supervisors in San Diego. And at that point, it was an initiative. It was a 10-year plan. But just a few years into it, it clearly outstripped being a plan, but more of a movement. And I'll explain by giving you some examples that illustrate that in a moment. But what was really important from the get-go, we said, is that we can't do it with health alone. We can't do it with just public health. Although if Dr. Georges Benjamin was here, he would say, public health is all-encompassing. I agree. But we need, in the presence of violence, you can't achieve health. The homeless that we saw outside this great building, without a home, they can't achieve health. And so for us, it was about building better health. It was about living safely and then thriving, which we refer to as the natural and built environment, as well as civic engagement. The issue about how do we become civil with one another? How do we engage in our communities? And so our definition what, as most, I think, in communities go well beyond just what public health is or what the World Health Organization is. We elaborated to say it was the state of the sense of safety, not only just being safe, just the sense of safety. Your career prospects, your emotional well-being, your spiritual well-being, hopefulness. All of these things matter. All these things are what we want for ourselves, what we want for all San Diegans. And so we developed an action framework. The only thing I remembered from my food class in high school, the food pyramid, I took that. I remember it was a pyramid, Tom. And we populated it with a couple of other things, okay? But we talked about what our vision was, and we talked about that our 4 approaches is about building a better service delivery system. Yes, we need access to care, primary care, and how we connect from hospitals to clinic to nursing homes to school health and so forth. That is a delivery system. But we also need to help people with positive choices. We don't believe in being big government. We believe in San Diego being government as an enabler, as a partner with people, and educating them about choices and information, about policy and environment change, the 3rd approach, and lastly, changing culture from within. And that is, if we're going to tell people to do these things, we best do it ourselves, look ourselves in the mirror, and be prepared to do the same in our own respective organizations. And you'll see why that matters so much to those outside of government when your government is coming up and standing up a plan of such. And then our 5 areas of influence. It was important for us that we linked it to measurement. We can see forward progress or where we were not making progress. And so talking about health and the issue about knowledge and standard of living, community, and social, and I'll define these, but you could see that these 5 areas of influence then lead to these top 10 live well indicators. And yes, we're measuring life expectancy. Because after all, what's the true metric? Longer, happier lives. Not longer and grumpier. That's not what we want. And clearly not shorter. And we know they are lives that have been lost and losing in some areas of where we have disproportionality. So I love this. Dr. Benjamin likes to use philosophers, so do I, comedians. I like to use the philosopher from Ireland, Bono from U2. And he said the greatest scale requires the simplest idea, and it's connecting with people. And I put in parentheses, in all places. So this is about connecting with people across sectors in all places. This is about the strategic alignment of government in business, in other cities, in schools, and the community. It feels good to say that. But how do we go about doing the strategic alignment? And then how do we ensure that this is a community-led, that health and wellness is local? How do we not forget about the resident leader? And we have, in fact, as robust a campaign about all sectors, Resident Leadership Academy. Making sure the people that live there, that have been living there for generations, are going to also be involved. And in fact, the leaders in this type of cross-sector transformation we're talking about, excuse me. So fast forward from when we started, we can't do it alone. And we are honored actually now to have 273 different organizations. And one of these organizations, for example, is our Chamber of Commerce that has 3,000 companies, and that's considered one partner. Or one of our food distribution centers that has 26 stores is considered one partner. When you look at these very diverse partners, we call them Live Well partners, which is schools and businesses, we're talking about almost 2.5 million of our 3.3 million that we're reaching and touching. That these organizations already have an ability of engagement, but now under the movement of wellness, coming together and defining across those 5 areas of influence what they bring. So the concept is not about more money. We all want that. But how do we leverage existing resources in a way that drive outcomes? And I have found that not only in San Diego, in many communities, we have not fully optimized existing resources because we haven't brought in, perhaps, those sectors in a way to leverage. And the measurements and the results and the indicators are illustrated from what I mentioned, from life expectancy all the way to the issue of community engagement. And we have as most people, a website, a portal. We wanted to be this outward facing so people could see how we're progressing. So how do we put all this together? How do we lead well to live well? Let me quickly give you some examples. Here's the first one. As I mentioned, heart disease and stroke is the second leading cause of death in San Diego. And when you talk to cardiologists, when you talk to primary care doctors, when you talk to folks, it's starting with something as simple as know your numbers. Do you know your numbers? And when you talk to them, say, we wish people would know their numbers. So we embraced on 7 years ago to do on Valentine's Day, a free blood pressure screening. Now you might think, oh, come on, that's hokey. It was Kaiser Permanente, ourselves, another one of our health plans got together, and we said, let's just open up some sites. Well, fast forward that, and year after year, more partners joined in. You ever see that little YouTube of the guy dancing by himself? And all of a sudden, people join and it becomes a social movement. Well, this is how Love Your Heart has transpired. We added fire stations, libraries, beyond just the traditional places where people think of their health clinics. And across all these sectors, we're beginning to see the impact of people knowing their numbers. In an 8-hour period, this past Valentine's Day, we did 53,000 blood pressure screenings. 160 different partners, 340 different sites, Mexico, 6 states of Mexico, and New Bedford, Massachusetts, and parts of Orange County north of us joined us in this effort. But here's the key. How do you measure that? The benefit we've had for people? We probably can't. But we know there were 100 people, over 100 people that were rushed to urgent care. And had they not done their blood pressure, they would not be here. This is what we have found year after year. Half of the population also prehypertensives with hypertension. Some of them not knowing it. Or what we did with Chula Vista Elementary School, the second largest school district in California. At the time, in 2010, they had about 25,000 kids. They started seeing kids were missing school. And what they found was this. Kids were 40% of the school had an abnormal body mass index. They were overweight or obese. 40%. That was not living healthy. Those kids weren't learning. So we came together with them in 2010 and said, how do we make this improvement? And you could see everywhere from the police department of taking back parks, making sure we had safe walkways for where they live, to where they go to school, to what we did in the school policy. It wasn't just taking away the cheesy nachos, which I will say was almost like mutiny when we did, and replacing it with book club. It was all of these things together, and this is the power. That in a 4-year period, 17% reduction, as the superintendent Escobedo would say, it fills an entire school of some 1,500 kids that are now in normal weight, off medications, and thriving. It couldn't have been done with just the swim lane of that one sector in school. They needed the rest. And we're not done. Even with this reduction, there's still more to go. But here's the thing. We learned from that. Tools for schools. We're applying that now for the 600,000 school-age kids we have in San Diego with our other school districts. Maybe not all as bad as Chula Vista in different degrees, but it was the whole issue about cross sectors coming together to improving our lives of our kids. Homeless. In San Diego, we're the 4th largest number of homeless. And it's simply this. No home, no health, period. And therefore, how do we tackle this from a public health lens? We know when we looked at our H3, Health, Housing, and Human Services, noble as that was, of looking at housing and treatment services and looking at how we were going to make sure they slept more in their own bed than a jail bed, than a hospital bed, or worse, in a medical examiner gurney. It was looking at a whole person wellness. It was bringing the cities, it was bringing the police departments, the sheriff, the health plans, the providers, everyone really coming together. That now we are linking hundreds of people in home, providing that type of wraparound services. And this is a long journey for us, but it realizes that it's the full sectors, across sectors. My last example is we are partnering, we're honored to partner with APHA and the National Association of Counties and Aetna Foundation. Mary Lynn's here from Aetna Foundation on their Healthy Cities and Counties Challenge. And we were one of the innovator sites. And we said, could we take what we've been doing with heart disease and diabetes and homeless and many other examples. And can we apply it to entire communities that had not living well and across many of the indicators? And we picked these 4 live well communities that had some of the greatest disproportionality and disparities in their health. And lo and behold, again, and this is now more our 2nd year into this, working with the communities, the big takeaway, what the community said, it was about job creation, safety, and access to healthy foods as their priorities. The community spoken, and now we're working across all sectors to achieve that with the community resident leaders. And we know that the characteristics in all these examples I just gave you is that, in fact, it has to be a cross-sector approach. It's not just population-centric or person-centric, it's both across the lifespan. It's that collective impact in a way that's measurable, community-led. And I would say strength-based, focusing on the assets that are in the community. They're already there. And then learning. So 5 takeaways from all this from San Diego is that we're still learning with you. I'm here to share, but we have a long way still to go. But we know these 5 things for sure. You got to keep it local, you got to keep it simple, you got to keep it real, you got to keep it moving, and you got to keep it upbeat. You got to keep it local. It has to be at the neighborhood level. That engagement with the residents matters. That activation is where it starts. You got to keep it simple, potent simplicity. Sometimes we come up with great intent, but they're thick reports, very hard to understand. And so how do we make it understandable for ourselves and then the community to understand it so they can engage? How do we also harmonize all the different data and different things and all the different swim lanes and sectors and humanize it? How does it impact the life of that grandmother, of that school-age kid, of that police officer? How do you keep it moving? Not all one size, but remember that this is a marathon, not the sprint, and upbeat. How do we acknowledge, and this is the part we have to probably step it up more, that we have to acknowledge the Postal Service. That's right, the U.S. Postal Service is part of our effort, checking on people. Talk about a free, great service, but we don't tend to recognize the Postal Service sometimes. How do we recognize all folks when we do this cross-sector collaboration? Because here's the thing, our job is writing the sequel to that Institute of Medicine report. And the sequel is Longer Lives, Better Health. And we're only going to do this with that cross-sector collaboration. And we have to go it together. We can't do it alone. So thank you so much for allowing me to share what's happening in San Diego. And live well. Thank you. I have a few minutes, I know, for questions. Are there any questions?
If we do have questions, if we could please use one of the mics on the side to make sure that our audio picks that up.
The question, if not heard, is are we doing anything for mental health and involvement? And I would say mental health has become not only our priority, the example I mentioned in terms of the live well communities or the homeless, mental health plays a key role. But we see it a little broader than mental health. That was that whole person wellness. We see it as behavioral health services aligned with housing and primary care and food access. So that plays a very key role for us, and that's the definition of how we define wellness. So thank you for that question. Thank you very much.
Do we have any questions on coming in from Twitter? No questions from Twitter, and we're in the room. Thank you very much.